Well, as we mentioned earlier, the federal mask mandate for travelers is no longer in effect.
Americans can now board planes and trains without wearing a mask.
A federal judge in Florida ruled the CDC exceeded its authority, and all of the major airlines in the U.S. dropped their mask requirement. UW Health's Chief Quality Officer, Dr. Jeff-Pothof, is back for this weekly visit. How are you?
I'm good.
Good to see you.
What's your reaction to this? It's 2 weeks earlier than planned, right?
Yeah, I think there's a little bit of a gamble, but it might turn out fine. So what we think will happen is with BA2 being more contagious, we'll see more cases, but because of lingering immunity from our Omicron surge and folks who are vaccinated and boosted, it may not result in increased hospitalizations. Now, if we're wrong on that and we start to see an increase of hospitalizations, we'll look back and say, boy, I wish we didn't pull those masks off of airplanes, because that's a good way to get cases to spread around the country. So we'll see in the next couple of weeks. I think that's why the CDC wanted to extend just a little bit to say, is what we think going to happen, or are we actually going to see hospitalizations and we should hold things a little bit tighter for a little bit?
So are we at the point where we're pretty much just making individual decisions about whether we want to wear masks and moving on?
Yeah, I think in general, I'm not sure if there's anywhere in the U.S., other than maybe a couple school districts, where there are mandated mitigation efforts. It's kind of individual choice as to, your risk profile, what you want to do, and whether you want to wear a mask. If I'm on a plane and I'm going on vacation, maybe I wear a mask because I don't want to get sick when I'm sitting on the beach.
I think Philadelphia has an indoor mask mandate right now.
You're right.
It just started on yesterday, I believe.
Yeah.
Is it going to be hard, let's say the hospitalization rates go way up, it's going to be hard to convince people to mask back up?
Well, and will the CDC have authorization to reimpose the mask mandate after this ruling?
Yeah, I think these are all great questions, but my guess is it will be very hard to pull back. I mean, this feels good. It feels good to not have a mask. Looks like the weather's going to start improving pretty soon. I think if things were to get worse and hospitalizations went up, we could have a real struggle to say, you know what, we need to pull things back for a little bit. Hopefully it doesn't happen, but none of us has a COVID crystal ball.
Maybe.
Well, go ahead. I'm sorry.
Just with the weather getting warmer, that'll help a little bit.
I think it helps in the sense that people tend to spread out. We do more things outdoors. There's less activities indoors. That can reduce transmission. Although I remember the first year we had COVID, we were like, all right, can't wait for July. Everything's going to calm down. And it didn't.
No, it didn't. Yeah. Well, it's much easier now to get an at-home test. Yeah. People are testing at home, but then they're not reporting the results of those tests. So how do we have an accurate picture of where we are with cases?
The short answer is we don't. Just because there are so many people that are getting diagnosed with at-home tests and not reporting it, you can probably make inferences based on, rate of positivity cases that we're diagnosing in medical centers, doctors' offices, testing centers. But whatever that number is, it's an underrepresentation by some amount of what the real number of cases are.
And that's why you look at hospitalizations as the barometer.
I think hospitalizations is a better metric because it's hard. I mean, there's people who get hospitalized. That's an easily tracked measure. Hospitalizations is also a more important measure because that's what we really care about. If a lot of people get hospitalized with COVID, that means hospitals may have run out of resources to take care of COVID patients and other patients who have healthcare needs. That's a more compelling reason to bring back things like mask mandates. If we have cases and people have mild diseases, maybe we don't need to bring that back. But if we have cases and now people can't get hospital care, that's a problem for us.
Speaking of the hospital, you've tweaked your visiting rules at UW Hospital now. What changes have you made?
I mean, this is something we talk about a lot. So when we made the decision to limit visitors, that was hard because having family and loved ones with you is really helpful when you're hospitalized. We're going to be able to allow 2 adult visitors for our patients during normal visiting hours. Now, in order to do that, we have to have people masked up and we have to keep people safe. So it's not a free-for-all, but we do think we can safely have those 2 visitors, still keep patients safe, still keep our staff safe.
But there's not a health check when you walk in.
No, not necessarily.
But you have to wear a mask.
We'll have to wear a mask.
All right. Well, that's a sign of progress.
Yeah, I like it.
I wish we had a crystal ball,
Yeah, me too.
Maybe some other time. So you're feeling pretty good about things.
I feel pretty good about things. I really want to see how these cases play out. Like, do we start to see hospitalizations creep up? I'm hoping we don't, and if we don't, I'm still pretty optimistic.
What is the situation locally at UW Hospital?
It's not bad. We have COVID cases, but we're not seeing an increase in hospitalizations right now.
Oh, that's good to hear.
All right, Jeff, good to see you again. See you next week.
See you next week.
Always something to talk about.
Always something to talk about.